I'm Dr. Sunil Choudhary. I'm Director of Aesthetic and Reconstructive Plastic Surgery at Max Healthcare, one of the leading healthcare providers in India. We are based at New Delhi, Max Super Speciality Hospital in Saket. And today I'm going to actually talk about the latest trends in cosmetic surgery, the demand, the popular procedures, and also some of the safety issues and the advanced technologies and what is state of the art, what is cutting edge in plastic surgery. So if we talk about the trends in cosmetic surgery, I think in my practice, and ours is a big practice in the national capital, we have seen a rise of almost 20 to 30% year on year for the last 3 to 4 years. And the demand of cosmetic surgery is increasing as the awareness about the cosmetic surgery procedures increase. And there's a huge shift from patients in the age groups. Basically, previously people who were older age groups were approaching plastic surgeons to look younger. Now the focus is about looking in shape rather than actually looking younger. So we have a lot of youngsters now coming up for plastic surgery, I think because looks matter in every profession, and even if you're not a professional, still look matters. So although majority of the patients that we see in our clinic are usually women, so I would say about 75 to 80% of our patient population asking for cosmetic surgery is women, but then the rest are men as well. And we have seen a reasonable increase in the demand in men as well. Now, if we talk about the popular procedures that most of the women ask for, I think body contouring procedures, including liposuction-like procedures, abdominoplasties, or as we call it, tummy tuck in the layman's parlance, breast reduction and breast augmentation procedures. These are the most common procedures that we actually see women asking in the clinic. As far as men are concerned, we see a lot of increase in procedures like rhinoplasty. There are men asking for gynecomastia surgery as well. And I think rhinoplasty as a procedure, I must say, has found a lot of popularity in both the groups. We have a huge demand surge in rhinoplasty over the last 3 years. We have seen a fantastic demand of rhinoplasty. Talking about the latest advancements which have actually happened in the field of cosmetic surgery, when we talk about the body contouring procedures, I think one of the major advancements has been vaser liposuction, or as we call it, vaser liposelection. Now this is a technique whereby the ultrasound energy is used to emulsify fat, but then it spares the blood vessels and nerves, making it a very safe procedure. One of the advantages of this procedure is that it actually allows us to contour the body in a way which was not possible before, because it can actually tackle very stubborn areas of fat, like in females, the areas of love handles, the back rolls, and in the men, like gynecomastia. Gynecomastia is basically a large male breast. So we're able to actually do areas which we were not able to actually reach with normal liposuction. When we talk about the rhinoplasty, there has been a lot of advancement in the thought process, in the technology, and the technique of rhinoplasty. Majority of the rhinoplasty procedures now are done with an open technique, which allows us a greater exposure and a better planning. But one of the advancements in rhinoplasty has been the use of absorbable implant materials. The materials of implants which we used before, which were non-absorbable, were causing a lot of problem. But now for structural stability, we use what we call a PDS plate in many of these patients. One of the other advantages has been the use of minimally invasive techniques like endoscopic plastic surgery techniques, and that has been extremely useful in doing facelift procedures. So one can actually have a mid-face lift without actually having any visible scar on the face, because the approach is entirely through the scalp. So there have been a lot of advances, and there have been a lot of advances in the outpatients procedures as well. The role of Botox and the fillers, I think everybody is aware of, and the fillers are becoming better and better as well. There have been other newer technologies in the field of non-invasive body contouring, but I must say that most of these techniques, which are non-invasive, will produce only mediocre results, and they cannot really compete with the surgical procedures. One of the questions that I'm always asked is cosmetic surgery safe? Now, it is as safe as any other medical procedure. Cosmetic surgery per se is not different from any other surgical procedure. So if a patient is fit for a surgery, a patient is fit for cosmetic surgery as well. So usually we would screen the patients, just as we do for all the patients, and they would go through profiling, and they would actually meet an anesthetist, and if they're found to be fit for anesthesia and surgery, only then they're taken up for surgery. So an elective surgery in a young patient or a healthy patient essentially means that the risks are pretty low. Also, it's needless to say, it also depends on the facility and the operator, so the skill of the person, the experience of the operator, the plastic surgeon that you're actually getting the surgery from, and the institution where you're getting it done, obviously are of paramount importance as well. One very interesting thing that everybody asks me as well is that, am I the right candidate for cosmetic surgery? We need to understand cosmetic surgery, or aesthetic surgery as I prefer to call it, essentially differs from other fields of surgery. Why? Because it is not being done in patients who are ill. It's basically a wellness surgery. It's basically being done in patients who are really well, and the entire aim of this is pure happiness. So people are just using cosmetic surgery as a tool to improve their appearance, and I think there's nothing pathological about it. I mean, everybody wants to look beautiful, and I think all intelligent beings appreciate beauty. So I don't think there's any pathological thing about it. As long as one is psychologically stable, I think this is a perfectly valid surgery to have. So I think overall, our experience with aesthetic surgery patients has been great. I think the amount of gratification, happiness they actually get out of these endeavors is very promising, and it's very heartening as well. So anybody who is conscious of their appearance, I think they must pay a visit to the plastic surgeons, and if they're a good candidate for surgery, I think it's a perfectly good solution to improve their appearance.